This is the branch you should join, and it will give you a sense of satisfaction. Money-wise,
start next session on pain medicine. It gives me immense pleasure to invite our very own Dr. Naveen Malhotra sir to enlighten the young anesthesiologist about the wonderful field of pain medicine. Sir is Senior Professor and Head, Department of Cardiac Anesthesia in PGIMS Rohtak. He is Deputy Chair at ARS WFSA, World Federation of Society of Anesthesiologists, Honorary Secretary, SARC Association of Anesthesiologists. He has won the ISSP Bhopal Award for Academic Excellence 2015, KPR Young Anesthesiologist National Award 2009, KAPS Award for Trauma and Critical Care 2001. He has 216 publications in various national and international journals and 426 presentations. Dear ISCN, relate to him as our own secretary. His areas of interest are chronic pain management and cardiac anesthesia. He is such a multi-talented person, an eloquent orator, academician, teacher, and with great organizational skills. His endless abilities and hard work continues to inspire all of us. Welcome, sir. Now, I would like to invite speaker for the session, Dr. Anurag Agarwal. He is pain spine physician and professor in Department of Anesthesiology, Dr. Ram Manohar Lohia, Institute of Medical Sciences in Lucknow, India. He is member of Pain Board in National Board of Examinations, Honorary Secretary, Indian Society of Pain Clinicians. He is founder president of Endoscopic Spine and Interventional Pain Society. He is vice president UP chapter, and he is member of Ethics Committee, Cancer and Society. His areas of interest are interventional pain and endoscopic spine management. Welcome and over to you, sir, Dr. Anurag Agarwal.
Thank you very much, Dr. Naveen sir and the whole KAPS team for this wonderful initiative for the newbies of the and future of the anesthesiology. And I'm really happy to share my experience. I hope you can see my slide. You can see my slides. Hello.
All good, Dr. Anurag. Please
Yes,
go ahead.
yes. So, sir, as most of our listeners are newbies, so is the field of pain medicine, which is a newbie field, latest kid on the block, and we are going to talk a little bit about the why it is important to know about the pain medicine, also known as chronic pain management, for our future generation of anesthesiology. The reason is this. This is the latest study which has been done, and this is for the first time. It has been commissioned by the Government of India, and it has been published in the Journal of Pain, which is the Journal of International Association for Study of Pain, and it has been done by the Center for Population Research, Mumbai. Here you can see the part of India which is darker. They are having more patients of chronic pain, and in the another graph where you can see that this another graph where they are getting the treatment for the chronic pain. So you can see the large part of Indian population is suffering from various type of chronic pain. The incidence is around 20 to 30% more in the aged population. Another data, a little bit of from the CDC US, 1 in 5 American. That means every 5th American is suffering from chronic pain. More than 60 million people in America are suffering from chronic pain, and it's cost billions of dollars. Very common complaint, the incidence depending on the different age groups, it's 11 to 40%, and most common cause is low back pain, headache, migraine, neck pain, facial pain, cancer pain, where in cancer, up to 90% of patients suffer from severe unrelenting chronic pain. Women unfortunately suffer more and report more chronic pain across the world. This is a world data. And as the age increases, as eventually is going to happen with our country also, the age of living is increasing. So are the degenerative problems, which are the major cause of chronic pain problems. And billions of rupees, billions of dollars are being spent on the treatment of chronic pain. It's a huge menace, and perhaps it is going to be the main NCD, non-communicable disease, and a matter of concern to the whole world in coming few years. Poor sleep. Most of the patients are depressed. Many people, when they do not able to make a diagnosis for the chronic pain, they call that patient is depressed. That's why he or she is having pain. But we as a pain physician knows it as a matter of fact that because of pain, they are being depressed. Once you treat their pain, they get better. So what is pain medicine? Now the question arises, why do we need to talk about it? So is it the post-operative, peri-operative pain management? The answer is big no. This is the post-operative and peri-operative pain management is the part of mainstream anesthesiology services. That is the peri-operative care. Is it acute pain management? Someone is having some bumps here and there, and he's having, or is someone is having renal colic? Is it the job of a pain physician to deal with it? No, that is part of managed by every doctor with every specialty depending on their specialty. So what is pain medicine? It is a new and emerging super specialty of anesthesiology. I beg to differ from my previous speaker, Dr. Rajesh. In India, there are no subspecialties. Cardiology is not a subspecialty of medicine. It is considered super specialty. So should be the pain medicine. Like the neurosurgery is the super specialty of surgery. It includes the evaluation and treatment of chronic pain, which is considered when pain lasts for more than 3 months. This is the most commonly accepted definition of the chronic pain word. And it requires at least 1 year or more of formal structured in-house training in pain medicine after post-MD or DNB anesthesiology. As I said earlier, many conditions which causes a very common condition, we all know about them, they all cause chronic pain. And what does a pain physician do? We treat and manage chronic, persistent, unrelenting pain by the multimodality. And what are the treatment options? We start like on all other treatment in the all other clinical branches with the pharmacological methods, and then comes our niche, that is MIPSI. And what is MIPSI? This is minimally invasive pain and spine intervention. That is the umbrella term of our interventions, like it is there in the cardiology with the name of PCI, percutaneous cardiac intervention. So this is the umbrella term what we do in the pain medicine. And then comes the non-pharmacological therapies, which we actually don't do, but we guide our patient towards the specialist of those non-pharmacological therapies like the acupuncture, biofeedback, hypnosis, physiotherapy, chiropractic, so many of them. So all these condition, again, just to remind you, lot of condition, everyday condition, perhaps most of us are going to face one or other of these condition in our long life. So like the same of our population. And what are the common MIPSIs? Again, start from the radio frequency treatment, cryoablation, neuromobilisis, pain biologicals or regenerative therapies, vertebral augmentation like the vertebroplasty, kyphoplasty. And the latest thing, one of the main major focus is on the percutaneous spine endoscopy, neuromodulation, spinal cord stimulation. So many of them, and every other day, new interventions are coming into the fore, and our armamentarium is getting bigger and better. So what are the treatment steps to consider when we treat a chronic pain patient? To identify the best method of treatment, and more importantly, define distinct goals for the patient. That may be pain reduction, and more than the pain reduction is the improved function and enhanced quality of life. So please mind it, chronic pain, like all other chronic diseases like the hypertension, diabetes, hypothyroidism, and so many kidney disease, liver disease. Unfortunately, many of time the chronic pain is also not cured by any of the things, except they can be beautifully managed. So what are the MIPSI? They are the interventions, minimally invasive percutaneous, to diagnose and treat the pain generators. And they are done under continuous X-ray guidance and known as fluoroscopy, like the cath lab, or ultrasound to avoid errors. So what are the benefits? They are almost painless. They are usually daycare procedures. They are cost effective. They obviate the need of open surgery and associated complication in most of the patient, and cost. So what are the specific needs of MIPSIs? It looks similar to regional anesthesia, but it is not. Please mind it, for most of the anesthesiologists, they confuse the MIPSIs with the regional anesthesia. It is entirely and absolutely different, 180-degree different. Why? Because in regional anesthesia, the main focus is to anesthetize a part of body for a certain period of duration with the motor and sensory blockade. But here in the pain medicine, the aim of any MIPSI which we offer to our patient of chronic pain to provide the longest term of pain relief without any sensory motor anesthesia, perhaps a cure. So they are not blocks or injections, they are complete treatment. When we remove a disc through the endoscope, it is the treating the prolapsed disc. We are not managing it, we are treating it. And there's no role of conventional blind approval with steroids. And C-arm fluoroscopy and ultrasound are must. They are standard of care, and they require complete OT setup. Why we as an anesthesiologist have an ACE? Because as the MIPSs are the niche of pain medicine, anesthetists have an natural skill to do minimally invasive interventions near the spine, like the spinal subarachnoid block or epidurals. And this is a part of mainstream anesthesia. Empathy and honesty are the virtues who come naturally to anesthesiologists, and which is very important in medicine and quest for more. What are the specific needs? Willingness to learn more and for long term, at least 1 year or more formal training is required. And I will tell you about the options available currently. Investment in terms of money and time. It is also very important to understand that here you have to hunt your patient and you have to share it. It is other way around in the mainstream anesthesia practice. Someone else is hunting for you and you are getting a share. But here you need to market, you have to invest, and here very important thing. In anesthesia, there is always an all-or-none phenomenon. Spinal का effect आएगा या नहीं आएगा? Whether the spinal is working or not, brachial plexus block is working or not, tube is going or not. But in pain medicine, it is always in between, like in all other clinical branches. And you need to ready to market yourself. There's no more behind the curtain job. Some specific advices: be ready to work in very hard in unknown territories. Why unknown? Because you need to learn about a lot of musculoskeletal things. You need to learn radiology a lot. You need to learn neurology, orthopedic examination and all that. No comparatively early and easy setups. In just after doing the MD anesthesiology or DNB anesthesiology, you you start getting calls from across the board. Please come and join us, please come and join us. But here, no, it's a clinical branch. It takes time to get established. Here, bouquets are yours, so are the papers. In anesthesiology, someone is there between you and the patient. Here, you are the friend. And pain medicine is a full-time job. Bit of anesthesia, bit of critical care, bit of pain medicine doesn't. The anesthesiologist need to say when to say no. So this is the list of government institutions where we are having formal standardized courses with the fixed curriculum and entry and exit exam. And this is the main part which I've been interested with. DM pain medicine. This is the first and foremost course of the India, as well as perhaps most likely in the entire world. And this is the first NMC or MCI recognized DM courses. Then comes the PDCC pain medicine, IEMS BHU Varanasi, duration is 1 year. And this is the oldest formal course in pain medicine, which has been conceptualized and started by Professor Virendra Rastogi, who incidentally was the founder secretary of the Indian Society for Study of Pain, as well as the founder president for the Indian Society of Pain Clinicians. He actually thought that formal training is required for the pain medicine. Then comes the PDAF, SGP, GIMS, Lucknow, 2-year direction. Then in multiple places like AIMS, KGMU, AIMS Rishikesh, Aligarh Muslim University, and whole list. And then very important thing happened just 2 years back, thanks to Dr. Naveen Malhotra sir for taking a lead into it, that we have started FNB pain medicine. This is again a registrable degree from the NBEMS, 2-year duration. And from this session, 2 batches, first time in the India, one at Chennai Super Specialty Hospital and one at Sir Gangaram Hospital, has been admitted for FNB pain medicine. So these are the list of government institutions. Then there are non-government but university recognized courses. Again, usually of 1 year or 1.5 year duration. One of them is MUHS affiliated courses for fellowship in chronic pain medicine at different places in Mumbai and Pune. And then comes the DY Patil in Mumbai. Then Vidyapeeth University Medical College. And then at Amritsar, Shri Guru Ramdas and Guru Ram Rai, both institute, and Mysore also. They are having a university recognized but non-governmental, but with the formal entry and exit examination. The complete list of educational opportunities in the pain medicine can be found at the website of Indian Society of Pain Clinicians. You can note it down. Another fellowship which is very important and has been granted by the Indian Society of Study of Pain. This is known as FIAPM. Duration is 1 year, and list of centers accredited by ISSP for IFAPM can be found on their website www.issp.pain.com. So once you have done the course, you are mad enough about to enter into the pain medicine, as we want some of you be. what are the options for the after doing your course? So in government sector, National Medical Council, the erstwhile MCI is yet to recognize the pain medicine as a separate super specialty. So if you want to join the government sector, you need to work in the mainstream anesthesiology department with all its pros and cons. So you better take a conscious risk. But at the same time, this the huge opportunities are there, both in corporate hospitals and private practice. Actually, we are having a supply crunch. There are a lot of demand, but we do not have people ready to jump into the fray, ready to ride the boat. Socially and financially, I believe that it is going to be a cardiology in the coming few years. So please take your call. And this is a teamwork. You need a complete dedicated pain medicine OT as well as OPD. And this is our teammate, Dr. Raman. This is my Facebook channel and YouTube channel. And I would be happy to help you for any question and related to pain medicine in future. So greetings. And this is what I was talking about. So it is no more of back of curtain job. It gives you a lot of recognition. Once we treat our patient with the results, and you may get a place on the front page of Times of India also. So thank you. Greeting from the Dr. Ramanullah Institute of Medical Sciences, Lucknow. And this is my WhatsApp number and email for me. Thank you for your patient listening, and I hope that we have some discussion. Over to Dr. Naveen. I hope I didn't take too much of time.
I'm covering up all of the aspect of the pain medicine. Neha, any questions? Amit and Neha, please.
Yes, sir. So as sir has rightly mentioned about the FNB programs that has been started this year, but it has been started with very few number of seats. So can you please throw in a light about the future of this FNB program? Because it seems very viable, a 2-year course, good enough time to learn pain medicine, especially after MD anesthesia. So Naveen sir, can you please guide us?
See, this is a landmark decision in the history of pain medicine. Our seniors and they have done so much for the recognition and establishment of pain medicine. And this is the first step towards the ultimate goal of starting DM pain medicine. This is a recognized course by NBEMS and simultaneously NMC. 2 years dedicated course for anesthesiologists, post MD and DNB. And the curriculum has been written by the anesthesiologist. Well, to be honest, the whole curriculum, I have written it down word by word. And the whole team supported us. There is a policy, the procedure has to be followed. This course was conceived before the COVID times, the COVID delayed it, but then there are centers which have to accredit it. And I'm very sure in the next session, more and more centers are applying for accreditation to the National Board of Examination in Medical Sciences. And next year, in the next session, definitely the FET exam. Right now, I understand there are only 3 seats, one in Gangaram and 2 in Chennai. But next year, we will be having more number of seats and more number of institutes will be applying for this particular course. And yes, those who want to pursue career in pain medicine, this is a recognized course by National Board of Examination and NMC, and it is a very, very useful course. You can opt for it and undergo exclusive training in the field of pain medicine. But our ultimate aim is we are pursuing the Indian Society of Anesthesiologists, Indian Society of Study of Pain, and Indian Society for ISSP, the pain clinicians. We are all working together, and we have represented it to NMC formally also and met there multiple times, and other authorities, met the governor of the UP or the governor of the Assam and other concerned that there is a dire need for starting DM in pain medicine. And we have submitted the proposal also along with the requisite documents. And we are very hope with the collective efforts, we will be soon achieving our long-term vision of having DM in pain medicine.
Right.
And I would like to say a line that we want to assure you, future generation of anesthesiology people, that this time we are conscious and we are aware that we are not going to commit the same mistake which have been happened with the critical care some 20-30 years back. We are trying tooth and nail to keep it reserved for you guys, pain medicine as a super specialty of anesthesiology rather than to make it a multi-specialty. As the cardiology is reserved for the general medicine. So I would like to give you this as an assurance to you guys on the behalf of all three societies, ISA, ISSP and ISPC. So that we will have separate departments. We will have a lot of seats of DM in every college and every institution of the India.
Earnest efforts are being made at all levels. And we are, to be honest, myself, Dr. Anurag and Dr. Parvesh, we have personally went to NMC and talked to the chairperson of the PG Medical Board Education. And we all are working under the guidance of our seniors also to ensure that we become teachers of DM pain medicine and you all become students of DM pain medicine.
Yes.
So are there any other questions?
Not
there is
really,
one
sir, but
question in the box.
Yeah, please, Amit.
What is the scope of short courses in pain medicine, like of duration 1 month and
Yeah, I saw that in chat box also. And see, these short courses.
I would like to say one line. Look, in the previous talk about the cardiac anesthesia, someone asked a very pertinent question that how would I know that I am interested in cardiac anesthesia or not? So these short courses are very good. These short courses, conferences, workshops, they are very good during your duration in the MD or DM to check whether it is a cup of tea or not. Because as I said earlier, pain medicine is the latest, newest kid on the block. So in many of the institutions during the MD anesthesiology, you don't get the proper exposure to them, to the pain medicine, or sometimes for the cardiac anesthesia also. So it's better after taking the due permissions from your seniors and teachers, you please join these courses, you join the workshops, the conferences during that MD duration, so that you can make a conscious and early decision while you are clearing your MD and DNB. But certainly they cannot replace, no course of the short duration cannot replace the formal training in any stream, leave aside the payments.
Thank
So
you, sir.
there are many questions coming up in chat box, which me and Dr. Anurag will answer for the benefit of the audience, and they will be live for all to see. And thank you, Dr. Anurag, for joining us today. And I hand it over to Dr. Ankur Khandelwal to carry it forward.
Thank you, sir, and your team, and also best wishes for all the students who are listening to make a conscious choice there about their careers.
Thank you.
Thank you very much.
Over to you, Ankur.